Docusate Sodium 283 mg per 5 ml Enema Laxatives are used to treat occasional constipation. Docusate is a stool softener that works by increasing the amount of water the stool absorbs in the gut, making the stool softer and easier to pass. This product usually results in a bowel movement within 2 to 15 minutes. It's important to check the ingredients on the label even if you have used the product before, as the manufacturer may have changed the ingredients. Also, products with similar names may contain different ingredients meant for different purposes, so using the wrong product could harm you. When using this Docusate Sodium 283 mg per 5 ml Enema Laxative, make sure to follow the directions on the product package. If you have any questions, consult your pharmacist or doctor. Before and after using this product, wash your hands. Lie on your left side with your knees bent, or you may kneel and lower your head and chest forward until the left side of your face is resting on a surface with your left arm folded comfortably. You may also administer it while seated on the toilet. Gently insert the enema tip into the rectum with a slight side-to-side movement. Do not force the enema tip into the rectum. Squeeze the tube until nearly all of the liquid is inside the rectum. Use this medication only when needed and do not use it for more than 1 week unless directed by your doctor. If your condition lasts or gets worse, or if you think you may have a serious medical problem, get medical help right away. Some side effects of Docusate Sodium 283 mg per 5 ml Enema Laxatives may include rectal irritation, burning, or itching. If these effects persist or worsen, it's important to contact your doctor or pharmacist. It's important to note that your doctor has determined that the benefits of this medication outweigh the potential side effects for you. While many people do not experience serious side effects, it's important to seek medical attention if you experience rectal bleeding or signs of a serious allergic reaction such as rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects. If you're in the US, you can report side effects to the FDA, and if you're in Canada, you can report side effects to Health Canada. As always, consult with your doctor or pharmacist if you have any concerns about the use of this medication. Before using Docusate Sodium 283 mg per 5 ml Enema Laxatives, make sure to inform your doctor or pharmacist about any allergies you may have, as this product may contain inactive ingredients that can cause allergic reactions. It is important to consult with your healthcare provider if you have any health issues such as rectal bleeding, severe abdominal pain, nausea, vomiting, or sudden changes in bowel habits over the previous 2 weeks before using this medication. Additionally, if you are pregnant or breastfeeding, it is important to discuss with your doctor before using this medication. If you are planning to have surgery, be sure to inform your doctor or dentist about all the medications and products you are using. It's important to be aware of potential interactions with other medications while using Docusate Sodium 283 mg per 5 ml Enema Laxatives. It's always a good idea to keep a list of all the products you use and share it with your doctor and pharmacist. And remember, never start, stop, or change the dosage of any medicines without your doctor's approval. One product that may interact with Docusate Sodium is mineral oil. If this medicine is swallowed, it can be harmful. If someone takes too much and experiences severe symptoms like fainting or difficulty breathing, it's important to call 911 or a poison control center immediately. In the US, you can contact your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Make sure to attend all your medical and lab appointments as recommended by your healthcare provider. To avoid constipation, it's important to include enough fiber in your diet, stay hydrated, and engage in regular exercise. This medication is intended for short-term relief of constipation, so it's important not to rely on it for extended periods. It's best to avoid using this medication for a long time in order to prevent dependence on laxatives. As a YouTuber hosting a Drugs and Medications AZ channel, I'm here to talk about Docusate Sodium 283 mg per 5 ml Enema Laxatives. This medication is used to treat occasional constipation. It works by increasing the amount of water in the stool, making it softer and easier to pass. The usual dosage is 50 to 200 milliliters as a single daily dose, with the best time to take it being in the evening. Be sure to follow the dosage instructions provided by your healthcare professional. Make sure to check the storage information on the package, and if you have any questions, ask your pharmacist. Keep all medications out of reach of children and pets. Do not flush this medication down the toilet or pour it into a drain unless instructed to do so. Properly discard this product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for more information on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.